We will learn about the drug ibuprofen. Ibuprofen is a drug that is used to relieve pain from various conditions, including headache, dental pain, muscle aches, or arthritis. The drug was developed or synthesized in 1961 by two scientists, Stuart Adams and John Nicholson. Chemically, the ibuprofen is a propionic acid derivative. Propionic acid is a carboxylic acid derivative, which is a naturally occurring organic compound. And from this propionic acid, the ibuprofen drug is synthesized. The mechanism of action of ibuprofen is that it inhibits the COX enzyme. Now, to understand the enzyme, we'll start from the basics. We all know that our cells have cell membranes, and these cell membranes are composed of chemical compounds, which is known as phospholipids. So, any stimuli, any injurious stimuli, and the stimuli, it could be any toxin from bacteria or virus or any tissue injury, it causes the release of arachidonic acid from the cell membrane phospholipids. Now this arachidonic acid, it will initiate a series of pathways, and one of the pathway that it initiates is the induction of COX. COX is a short form of cyclooxygenase. Cyclooxygenase is an enzyme that plays an important role in the production of prostaglandins and thromboxanes. Now, the arachidonic acid, it synthesizes two kinds of, or it activates two kinds of COX, COX-1 and COX-2. The COX-1 is present physiologically in the body at all times, and it is responsible for the production of prostaglandins and thromboxanes in the stomach, kidney, and platelets and intestines, and it plays a role in the mucosal production and renal blood flow and the homeostasis. The COX-2 is an inducible form of the COX, and it is induced in response to any toxic stimuli. This COX-2, it produces the prostaglandins at the inflammatory sites, and it causes the inflammation and pain and fever in the body. What actually happens is that ibuprofen, it non-selectively inhibits both these enzymes. It will inhibit the COX-1 and COX-2, both of these enzymes, and it inhibits both the pathways. So the anti-inflammatory, antipyretic, and analgesic effect is the desirable effect after the administration of ibuprofen. However, there are also certain adverse effects that are associated with the use of ibuprofen that can be explained by this mechanism. As the ibuprofen, it also inhibits the production of physiological prostaglandins that plays an important role in the mucosal protection and renal blood flow. So if I summarize the mechanism, ibuprofen will inhibit the COX and the production of the prostaglandins, and thereby it has an anti-inflammatory, antipyretic, and analgesic effect. Ibuprofen is used in the treatment of pain and fever associated with a variety of infections and pathological conditions. It is a very excellent drug which is used to relieve pain that is associated with the menstrual cycle or muscle aches or in the setting of osteoarthritis, as ibuprofen also has an important role in preventing the process of inflammation. So it is used in the treatment of osteoarthritis as we utilize the combined anti-inflammatory and anti-analgesic effect. It is also used for the treatment of fever that is associated with a variety of viral and bacterial infections. Ibuprofen is also used for the treatment of for the closing of patent ductus arteriosus, which is an opening between the two major arteries of the heart. It is the ibuprofen has an also it is also available in a formulation that is used as a topical cream because it is well absorbed into the fascia and the muscle, and thereby it is used in the treatment of knee osteoarthritis. So it has wide application in the management of pain and inflammation with a favorable adverse effect profile. As far as the dose is concerned, we give ibuprofen in 400 to 800 milligram every 6 to 8 hours. We can repeat the dose after every 6 to 8 hours and not to exceed the maximum dose of 3.2 gram per day. So we can use this dose to treat arthritis and the pain that is associated with a variety of medical conditions in the dose of 400 to 800 mg. But we need to remember that we cannot exceed 3.2 gram in 24 hours for the drug ibuprofen. As Now let's discuss the pharmacokinetics of ibuprofen. Pharmacokinetics is the study of what happens when the drug enters the body. We can define the pharmacokinetics under these four categories: absorption, distribution, metabolism, and excretion. So ibuprofen, it is readily absorbed from the gut, and the onset of action is 30 to 60 minutes. If you give your patient ibuprofen, it will take around 30 to 60 minutes in order to kick in the drug and produce its analgesic or antipyretic effect. And the duration of action is 6 to 8 hours. That is why we repeat the dose after every 6 to 8 hours if the drug effect is not sufficiently achieved or the pain recurs. The distribution, it is widely distributed in all body tissues and is 99% protein bound. So very few concentration of the drug is available in the plasma as the free form, and the rest of it is protein bound. The metabolism of ibuprofen is hepatic. It has two isomers, the S isomer and the R isomer. This S isomer is the active form of ibuprofen. However, both of these isomers, they are metabolized in the liver and are excreted by the kidneys and the urine. The most important things to remember from the category of pharmacokinetics is the onset of action, that it will take around 30 to 60 minutes for the drug to kick in and produce its effect in the body, and the effect, it will last for around 6 to 8 hours in the body. Along with an excellent therapeutic profile, ibuprofen has various adverse effects which are related or which are the direct extension of its therapeutic effects, and we have already discussed it under the mechanism of action slide. As we can see that ibuprofen, it non-selectively inhibits both COX-1 and COX-2, and as a result we achieve an anti-inflammatory, antipyretic and analgesic effect. However, the inhibition of COX-1, it leads to the inhibition of prostaglandins that are protective in the setting of renal function and blood flow and homeostasis. So along with the inhibition of COX-2, we also inhibit COX-1, and this is why there are certain adverse effects that are associated with the use of ibuprofen. A very effective method of remembering any profile, any adverse effect profile or any organ system effect is to go organ wise. So we have this model of organ system, and we'll discuss the adverse effects system wise. So in the brain, it causes aseptic meningitis. We need to be careful when using the ibuprofen. In the liver, it can cause hepatic injury and increase the liver enzymes. In the gut, it can cause ulcers as it inhibits the COX-2, and with the inhibition of COX-2, there is an inhibition of the protective prostaglandins. So ulcers can form, and nausea, vomiting is very common with the use of ibuprofen. It can also increases the risk of bleeding. Ibuprofen can also cause kidney injury, which can result in the retention of fluid, and this fluid retention can lead to hypertension in the body. It can also cause bronchospasm. So in the patients who are allergic to or who have had a reaction to aspirin, ibuprofen should be contraindicated in those patients. So there is a very important interaction that we need to remember with the use of ibuprofen, is that whenever you're giving ibuprofen to a patient that is also taking aspirin, you should know that ibuprofen, it antagonizes the effect of aspirin. So the aspirin, which has an antiplatelet effect, and if we're giving any patient the aspirin in order to reduce the risk of stroke or any other CVA, we need to remember that you cannot give those patients ibuprofen, because ibuprofen, it will reverse the antiplatelet effect of aspirin. So this was all about ibuprofen.